It's complex, but it's not as, we are getting to know the disease a bit better and better over time. So the idea is when the tumor starts, they will start to acquire different mutation, but they were forced to converge, and they converge on a specific pathway or phenotype. So if, and every disease actually diverge and converge for specific, follow a specific path. And it's because the disease is very different. But if you can know how they evolve and how they converge, then you can implement targeted therapy, not on only one driver. I would call it a few drivers, and those are early drivers. Then you can actually try to manage the disease. When they become more complex, then immunotherapy may be the most efficient way, because immunotherapy does not tell whether you carry this mutation or not. So they take care of most of the things. So that's why I think all the regimens they need to take into consideration for individual cancer patients and try to understand their disease, especially for the rare kidney cancer patients. But I think despite the complexity, as I said, there is a hinted convergence of disease. Once we study more, and then we'll know more, and then we will cure cancer. And I told people several times about this. Since we're on this, I'm going to talk about this. So Nixon said, want to conquer cancer in 1971, and have this, cancer, the era. Then the coalition was formed, in 1972. Now it's 2014, and if we say 50 years, it's 50 years from 1972, not 50 years from now. Okay, so that's what I really hated. People say, oh, I don't know how to deal with this, wait 50 years. So I think the goal is, let's see whether we can do as much as possible, as fast as possible, till 2022. So there's 8 years that we can play around, and we can make it if we really focus on something. It's very integrated nowadays, and when I was started at Hopkins as a PhD student almost 20 years ago, it was very hard to imagine. Now we can actually do things together, and when I started at Berkeley, we were doing so much basic research, and the basic research is very, very separate from the clinical research. And that did change over time, and I think the major revolution is really this next-gen sequencing. Now you can have so much capacity to know the disease, and they're so invariable. DNA is so invariable, right? So the RNA becomes very complex, protein metabolites, those are more complex. But DNA is the fundamental, and now you spend $1,000, it's just like $1 billion what they spent, when they started the Human Genome Project. So it's very, very, that totally changed the landscape. And by taking that information into your treatment planning and understanding of the disease, that's why we have hope. Otherwise, I would tell you like 5 years ago, I would not say that. But now that's why I'm pretty, convinced that if we really focus, and of course, it's not, I would say this, it's not just biologists. It's not just physician, it's not just radiologists, it's everybody. And it's really, I'm very interested in engaging in computational people from computer science. I talked to quite a few of them, from MIT, from Intel, from different places up the very, very top. But the problem is we are seeing different things. It's a very big disconnect, but the data is there, and I think it's very important to collect better data, well-organized data, and to analyze it in a way that we can, computer can analyze it, not human brain to analyze it, because we are built differently.